there feeling, brother?
Not good, bro. I just woke up from a nap, pounding headache, like the worst I've ever felt, bro.
Well, you been taking your medication, bro?
Nah, bro. I've been busy with work and everything. I just kept on forgetting. It's been 3 days now.
Bro, how about we get a day to ourselves? We go hoop today, bro. Make sure you take your medication.
That sounds good, bro. That sounds good. Let's go. Let's go.
Do it. Let's do it.
Yeah.
Check up, boy.
All right, bro.
Okay. Good, bro? You good? 911. Yeah. I got a buddy down here at the iron office who's hooping and he just fell. Yeah, he's unresponsive.
Unit 167, this is dispatch. We are having a 44-year-old male that's experiencing sudden collapse and loss of consciousness at the iron office.
Copy that, dispatch. Unit 167 en route, ETA 5 minutes.
We're going to be using PPE for the patient, which would be gloves.
I'm checking for any potential hazards. I don't see anything, so I'm going to assume scene is safe as of right now.
Our mechanism of injury seems to be fall,
We have one patient.
and we will be considering the call for ALS.
So what happened?
We was just hooping and he just fell. But he did tell me that he didn't take his medication today. He told me he was going to take it. I don't know if he did. He does have diabetes. He told me that he was hypertensive.
Sir, okay. Hey sir, can you hear me? Alright, patient semi-responsive. I'm going to check for any major bleeds real quick. I don't see any.
His airway seems pretty patent since he's able to mumble a few words, and we're going to assess his breathing. Right now, the patient's breath seems irregular with the rate and depth, so we're going to be using a BVM to help him breathe. We're going to be doing this at a rate of 1 every 6 seconds.
Patient's skin signs are pale, cool, and diaphoretic. He has equal radial pulses, and we'll treat for shock with a blanket, and he doesn't have any major bleeds. We're going to transport this patient priority 1 stat to the nearest hospital.
Alright, sir, I'm going to be conducting a fast exam for you. So right now we're going to be checking out your facial exam. Please smile. Alright, looks like it's only happening on the left side. And I'm going to be checking your arm drift. Please close your eyes and I'm going to hold out both your arms. And try to hold it steady, please, for me. Alright, thank you, sir. Right now it looks like his right side's being drifting downwards. And we're going to also conduct a speech exam for the fast part. Can you please say your name, sir? Alright, sounds like he's not able to pronounce words correctly. And excuse me, sir, when did the stroke symptoms start appearing?
Like 10 minutes before playing basketball.
10 minutes ago? Alright, thank you. For signs and symptoms, earlier he was showing that he had a headache. Right now he's showing arm drift and facial droop. Excuse me, sir, is there any allergies that he has?
Not really sure.
Not too sure. But how about for medications?
I remember him telling me he took medication for his hypo.
Hypo, okay. And for his past burn history, what did he have?
Not sure, but I know that he's diabetic.
Diabetic, type 1?
Type 1, sir, yes.
Type 1. And when was the last time he ate?
I'm not really sure. When I was talking to him, I would say probably 10 minutes to 15 minutes before we started hooping.
10, 15 minutes. And the events leading up to this was just him falling, correct?
Yes, sir.
Okay. Right now we're going to do is OPQRST. So, excuse me, sir. So during this onset, he just fell right away, correct?
Yes, sir.
And any provocation right now, it seems to be that whenever he brings up his arms, it would arm drift off. So provocation would be movement. For the quality, what would your worst pain be, sir? What is that? Is that headache, your heart? Alright, so the quality seems to be like the worst at his head. And for his region, it seems like only his right side was messed up during the Cincinnati stroke scale. And the severity seems to be 10 out of 10 since he wasn't able to move his right arm up. And excuse me, sir. You said that the timing was 15 minutes ago whenever you fell?
Yes, sir.
Alright. Alright, now we're going to start with 5 body systems. We're going to go through his cardiovascular system. So we're going to check his pulses right now. So right now, both of them are bilaterally strong. And we're going to check his respiratory system. Right now his breathing is pretty irregular with equal rise and chest fall. Next we're going to do his neurologic system. We're going to put a flashlight into his eyes. His right eye is affected. It's not constricting at all. And next we're going to go on to his nogumentary system. Right now he's seeming pale, cool, and diaphoretic. And his gastrointestinal system is pretty good. He's not vomiting or anything like that with nausea. We're going to reassess this patient every 5 minutes and transport him to a near stroke center.
So the diagnosis that we reached at the end of the video, or the end of the whole skit, was that the patient was following a hemorrhagic stroke. Hemorrhagic stroke is commonly known as a brain bleed, specifically due to an aneurysm in the brain that bursts, and then that creates intracranial bleeding, and then that also leads to intracranial pressure, which leads to the patient having an immense headache, which is why patients explain that their head hurts. It's like the worst headache they've ever felt. And yeah, it will cause all the signs of a stroke, such as losing balance, vision, blur, I believe, and it also results in irregular breathing potentially and slurred speech. Now, the patient in the video was experiencing left hemisphere, specifically due to the right body of the patient being weak, and also the speech was very slurred.
Hey, Gabe, you good? You good?
Can you say your name?